You know, it's
that they
very
propose.
obvious that from the polls being taken by many, many organizations out there, that the American public said it's about jobs. We need jobs in the economy in order to make things work. It'll reduce the deficit. It'll put people to work. It will start growing the economic engine of neighborhoods and states and the entire country. But what we're seeing is that there's this Republican assault on the middle class. They're cutting programs that serve the middle class. They're cutting programs that create jobs and invest in a new economy. But they're leaving alone these groups that are actually not, they're earning record profits, and we're still giving them hard-earned taxpayer dollars in the forms of handouts and subsidies to the oil industry, to various industries that are, just befriended by those in the House that want to play off the middle class and end Medicare, which is a very dangerous precedent that will be set. And Representative Courtney, or Representative Garamendi, you want to make a point
well,
on...
Mr. Courtney just pointed back to me. I was going to pass it to him, but we just talked about big oil, the subsidy that big oil that's being protected by our Republican colleagues, making sure that big oil gets their money. That's not the only thing. They are fiercely fighting fiercely to maintain the Bush-era tax cuts for the super wealthy. We're talking about millionaires. So what does it mean for millionaires to hang on to that tax cut that occurred in the 2003, I believe?
Right, 2003.
For millionaires, that tax cut is worth $200,000 a year if you have an income of $1 million. Now, there are folks out there that have incomes of $1 billion. So you can kind of expand that, add 6 zeros to it, and you get pretty close to what 5 zeros. You get close to what it might be for a billionaire, and there are billionaires out there. What's it mean for seniors? It means it's going to cost them some $6,000 a year in what will be their Medicare cost in the future.
And that's equaling 33 seniors.
Thank you. You read the chart better than I do.
33 seniors paying $6,000 more per year.
To equal the
so
1
we're
million.
making happy one millionaire, and we're economically distressing 33 seniors who are going to pay at least $6,000 more to have the health care coverage, if they in fact can get it.
And I think it's important to, again, just to sort of finish the point, is that we are talking about two programs right now that did not create the deficit issue and challenge that would face this country. We had two massive tax cuts for the super rich. We have two wars that haven't been paid for, and a prescription drug benefit which was passed during the last administration that was never paid for, which we dealt with in the Affordable Care Act to offset that. Trustees' report says that we've got till 100% solvency through 2024, 90% solvency through 2045, and 100% solvency for the Social Security system to 2037.
And Representative Courtney, when you talk about all of those costs, they were never put in the budget. They were off budget. So that meant that those two wars, the pharmaceutical deal for Medicare Part D, and the tax breaks for millionaires and billionaires all had to be borrowed money. And so we borrowed from China, Saudi Arabia, all to make it happen. This was dishonest budgeting, and it was favoring deep pockets over, evidently, seniors. And now the solution: end Medicare, block grant Medicaid, privatize Social Security. This is an assault on middle-class values, on our nation's seniors. Representative Garamendi, we'll move to you and close.
Mr. Tonko, thank you so very much for bringing us together tonight to talk about Medicare and the Republican proposal to terminate Medicare and significantly reduce Medicaid, a program for seniors in nursing homes. This is a pivotal moment in this nation. It really speaks to our values. It speaks to who we are as Americans, who we care for, and what we are concerned about. Mr. Courtney, I pass to you.
And I would just say, I'm sure your offices are like mine. This is the #1 issue that we're getting calls, emails, and mail on, is that are you guys going to stand up and live up to your sacred duty to protect these programs, Medicare, Social Security, and Medicaid, that our middle class depends on?
At least 9 of every 10 comments we get, either through the mail or on the phone, are save Medicare, save Medicare. Don't let them mess with it. We're fighting the good fight here. America needs to know that there's a risk of losing Medicare. There are those who want to end it. We saw another vote here tonight.
Thank you, Mr. Tonko.
With that, we'll yield back, Mr. Speaker.